Hi guys, while I was in the outpatients department, I also worked in dermatology, and this was one of my favourite clinics to work in, which I was really surprised. I didn't think it would be. I didn't think I'd be interested at all when they sent me to dermatology, but it was really, really interesting. I think partly I worked with a nurse practitioner both times I was there, because I went once and then I asked to go back because I loved it. And one of the things I would advise you guys is always work with a nurse practitioner. If they give you option of a doctor or a consultant, work with the nurse practitioners, because they are brilliant. They know that you're learning, they respect that you're learning, they really teach you these core nursing principles that you need to know, and they're happy for you to do things as well, which I think the doctors are a bit more unsure on what you can do and what you can't do, whereas the nurse practitioners let you do stuff. So in dermatology I worked the first time in the minor ops section, and they did biopsies here. So this was really cool because I was able to kind of scrub in, because it wasn't really in a theatre, it was just in a room and all the stuff was sterile, so I got loads of aseptic technique practice. I also was able to see the anaesthetic go in, the patient was awake, was able to do loads of patient communication and reassurance. Our patients were brilliant as well, really lovely patients, and we were able to do the biopsies, and then I was able to see all the suturing and things like that. Now the first time I watched, and then when it came to suturing she asked me if I wanted to have a go, which of course I did. So she pretty much held my hand and guided me in doing it. I did it once and then that was it. So the next time I asked if I could do it again, and I was able to I did 2 sutures on my own. Obviously she was watching me, it was under careful observation, but that was very exciting because some fully trained nurses have never done sutures. So that was a really exciting experience for me and I loved it. It was really great, and also just getting to see the layers of the skin as they are, because you're literally cutting into the skin, kind of peeling away the top layers of the skin, then the fatty layers, and then kind of the layer just before the muscle, and you got to see all that and feel all that, which was really, really great. The next time that I was in, I pretty much did similar things. I sat in her clinic, this time it was a lot of communication because it was after the multidisciplinary team meeting. Some of the patients were being diagnosed with skin cancers and things like that, and offering treatment. Skin cancers generally aren't as dangerous, so it wasn't all this kind of worry on the patients, but there was a lot of communication and reassurance, and I saw great communication again in this clinic and learnt a lot about kind of breaking bad news and explaining the different treatments and different procedures that we could do for them, and how we can help them. And again, that was a multidisciplinary team. It was a nurse practitioner, nurses, the doctors, the consultants, plastic surgeons, all going around to one patient together. They would all talk to them, follow the options. Some of them had radiotherapy, some of them got it surgically removed, and then that's where the plastic surgeons come in and things like that. So that was a really interesting experience and I loved my time in dermatology. And that's all I really have to say about that, so see you in my next video.